now I've measured out the water. I'm going to introduce it in the alginate mix, but you probably might have to add a little bit of water or perhaps a little bit of alginate back into your mix, okay? So hold your bowl from the underside and create a nice vigorous mix. Try not to spill it just like that, like I just did. So quite gently in the initial mix. And now what I'm going to do, I'm going to press it up against the sides of the bowl. Robert, you want to have a little rinse for us there? And you can hear the bit of the air bubbles coming out. So we get a nice smooth velvety mix. And then I'm going to scoop some up, introduce it on my tray from the inside out. A little bit on this side. That's good there. Go back to the patient. Okay, Robert. Nice and relax for me. Get you to open, relax your lips. Lift your tongue up a little bit. Relax your lips for me. Get it into position. You're gonna feel a little pressure now. And reorient the tray back to where we had it before with a little gentle move. Hold it there over the finger rests and kind of mold the impression around. Relax for me here. Stick your tongue out for me a little bit, a little more. And move your tongue a little left and right. Good. Relax everything for me now. You're okay with that? Okay. So I'm going to tentatively hold it there with my handle. The water was a little bit on the warm side, so it felt like a little bit setting rather on the quickly side, but we'll see. We'll see what happens. Just going to wipe off a little bit of the excess material here. The lower one is a little more challenging to do because you have the tongue in the way. So the tongue, it gets involved, gets you to open here. So this one is pretty much done. So just verify for a little stability. Looks pretty good. Just tug a little bit on the lips here and then remove it. If we engage the undercut, it's going to be a little more difficult. Now the first thing you want to do is look at your impression, but that's not what I'm going to do now. The first thing you want to do is look inside the patient's mouth. Make sure there's no leftover residue of alginate so they don't swallow any. Stick your tongue out for me, Robert. A little bit here and a little bit here. Have another little rinse for me here. And spit back in the cup and I'll take it away from you. Good, thank you. Now let's take a look at our alginate impression. Not bad, pretty good. A bit of a bubble here, but nothing significant that I can't work around. I'll show you this a little bit later on the model itself. Extension of the richer molar pad here. Yes, we have the wax kind of pinching on the tissue, but that's quite acceptable. We don't want to have the actual tray material pinching on the tissue. If I turn it over here too, we have a nice extension of the richer mylohyoid here, richer molar pad over around the buccal shelf and around the labial vestibule here, and we have a nice capture of the lingual frenum. So this is acceptable. I'll take that, we'll put that away, and I'll show you how we're going to store that. Come around here. I'm going to take 2 pieces of paper towel, but before I do that, I'm going to spray it with some Biotex and give it a nice thorough spray. And I'm going to let that rest for a couple of minutes. And what we're going to do by the time we take our maxillary impression, I'm going to take 2 pieces of paper towel, soak them quite well, squeeze the excess moisture out of it, and basically just want to have a layer of moisture surrounding that impression. So unfold them here. I don't want these towels to be soaking wet or dry. Because if they're soaking, it's going to introduce moisture back in the impression and it'll swell up the impression, okay? So 1 is generally enough, but I tend to do 2 just as a good measure. So I'm going to wrap that there and leave it there until I finish my maxillary impression. So once again, the technique for the maxillary impression is quite the same. Just going to clean up a little bit of my counter here. So notice anything that I've removed from the patient's mouth, it doesn't go on the table itself. It's always on a tray. It gets sprayed on a tray or it gets sprayed in the sink. So I don't have this cross-contamination of my whole working area here, okay? This bowl here that I used before, I can simply set it off to the side or put it inside the sink for now, and I'll clean it off together again. If this didn't work out well, or I used both batches of spatulas and it didn't work out well, I can use each spatula to kind of scrape the excess material off the other, if that was the case, okay? And of course you can give it a little wipe down with some wet paper towel. So that's fine there. I'm going to leave that there. I'm going to go back on the maxillary impression. So for this one, I'm going to lower the chair a little bit here, so I have a little more of a view. And I'm going to give Robert another Kleenex here to hold on to. You got one? Excellent. I'm going to take my maxillary tray, bring it right here so it's good to go. And we're ready to do another mix. Now for the maxillary impression, you really don't want to use a lot of cold water because it's going to prolong the working time of the material and it makes it quite uncomfortable for the patient, okay? So relatively room temperature water is ideal, and in fact you might want to have a little bottle, and so it gives you a nice consistency in terms of the temperature of the water, so you know exactly how your material behaves. So this is a nice thick mix here, which is ideal because I can control the compression of the material as well as the flow. You don't want to have it too runny here. So I'm going to scrape here, introduce it inside the tray, taper it off to the sides, and take a little bit here. I'll put it on the back of my hand, and you'll see why in a second. Robert, get you to put your head back for me. Now, I'm going to take this extra material here, get you to put your head back. I'm just going to put a little bit here on your palate. Just smear it a little bit. Wipe off the excess from my finger so I don't get it on the patient's face. Relax for me right there. Relax, 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 relax. So we're going to tug the lip, get into position, and then a little pressure. Relax for me again. Sorry. And tug a little bit on the cheeks to create a little more of a mold effect. You're okay with that? Good. Just breathe through your nose for me. So tray selection is very important. You know, if you have the wrong tray, no matter how good your impression technique is, you're not going to get the right impression. So get comfortable selecting your trays. If you're not sure, ask one of your instructors. They'll be more than happy to help you out. And just like Robert mentioned earlier, that it felt a little bit big, that's okay. That's what we're looking for. We want a little slack around the tray to give us room for the alginate. So this is quite set, I think, now. If you're not sure, you can use the back of your mirror and you can poke the impression somewhere, wherever you see it, and you want to have a nice stiff result. If you have any imprint of the impression as you're poking it with the back of your mirror, that means it's not ready. So a little tug here. We're going to pull this out. Make sure everything is nice and clean. We're going to give Robert a little rinse here for him again. Have a little rinse. Just spit back in the cup. Good.